Poor circulation, memory loss, even heart failure. All of them can start with something as simple as a dry mouth when you wake up. Most people reach for a glass of water and move on with their day. But what if that dryness isn't thirst? What if it's mouth? We're talking about something that could be affecting your kidneys, your heart, and your brain at the same time. I'm Dr. Nathaniel Brooks, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've sat across from thousands of men and women over 60 who came in complaining about something that seemed minor, only to discover a serious underlying condition that had been hiding in plain sight. Morning dry mouth is one of those symptoms. Deceptively simple on the surface, potentially life-changing underneath. What I'm about to share goes against what most people assume about their own health, because we've been conditioned to believe that aging naturally brings discomfort, that a dry mouth is just part of getting older, but that's not the full truth, and I refuse to stay silent any longer. If this information seems valuable to you, hit that like button right now. It helps this message reach the people who truly need it. Let's talk about what's actually happening inside your body when you wake up parched every single morning. Your mouth depends on a constant supply of saliva, and saliva is not just water. It is a complex biological fluid packed with enzymes, antimicrobial proteins, minerals, and compounds that protect your teeth, your gums, your throat, your digestion, and even your immune system. When salivary glands slow down, or when other body systems begin to malfunction, saliva production drops. And when it drops significantly, your mouth dries out, especially overnight when you are not drinking, not talking, and not stimulating salivary flow. After 60, your body produces roughly 30 to 40% less saliva than it did in your 40s. That alone creates vulnerability, but that baseline reduction becomes dangerous when it combines with the 7 causes I'm about to reveal, because each one of these causes doesn't just dry out your mouth. Each one points to something deeper going on inside your body. Here's what terrifies me most. Chronic dry mouth is associated with a 45% higher risk of systemic infections in adults over 60, according to research published in the Journal of the American Geriatric Society. Why? Because saliva is your body's first line of immune defense in the mouth. Strip it away, and bacteria, fungi, and viruses have an open door straight into your bloodstream. So let's go through the 7 reasons your mouth is dry when you wake up every morning. We'll go from the least dangerous to the one that concerns me most, and by the time we're done, you'll know exactly what to look for, what to tell your doctor, and what changes you can make starting tonight. Before we dive in, I want to ask you something. How long have you been waking up with a dry mouth? A few weeks? A few months? Maybe years? Type your answer in the comments below. I read every single one, and your response helps other viewers realize they are not alone in this. Number 7, sleeping with your mouth open. This is the most common and most overlooked cause of morning dry mouth in adults over 60. And before you think this one is obvious and harmless, I want you to hear me out. Because mouth breathing during sleep is rarely just a habit. It is almost always a symptom of something else. When you breathe through your mouth at night, airflow passes directly over your tongue, your palate, and the back of your throat. That airflow evaporates moisture at a rate that your salivary glands simply cannot keep up with while you sleep. The result is a mouth that feels like sandpaper when you wake up, cracked lips, a thick or coated tongue, and sometimes a sore throat that has nothing to do with a cold. Here's the deeper issue. Mouth breathing during sleep is frequently caused by nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea in particular is a serious condition that affects nearly 22% of adults over 65, according to data published in the journal Sleep Medicine Reviews. Left untreated, sleep apnea is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. So if you are waking up with a dry mouth and you also snore, feel exhausted in the morning despite sleeping 7 or 8 hours, or if your partner says you sometimes stop breathing during the night, please do not dismiss this as simple mouth breathing. Talk to your doctor about a sleep study. The practical fix for true mouth breathing without sleep apnea is surprisingly simple. Nasal strips worn across the bridge of your nose before bed can increase nasal airflow by up to 38%, encouraging nasal breathing throughout the night. A humidifier in your bedroom set between 40 and 50% humidity also reduces overnight moisture loss dramatically. And sleeping on your side instead of your back significantly reduces the tendency to breathe through your mouth. Pro tip: a small piece of surgical tape placed vertically over the lips before sleep sounds unusual, but sleep specialists have used this technique for years to train mouth breathers back into nasal breathing. It is safe, inexpensive, and many patients notice a difference within the first week. But this brings us to number 6, something far more surprising. Number 6. Dehydration that starts in the afternoon. Most people assume that if they are waking up with a dry mouth, they simply need to drink more water before bed, so they gulp down a large glass right before sleeping. And that doesn't fix the problem, and here's why. Your body does not hydrate in real time. When you drink water, it takes between 30 minutes and 2 hours for that fluid to be absorbed, distributed to tissues, and made available for functions like saliva production. Drinking water at 10 at night does almost nothing for your mouth at 6 in the morning. The real issue is afternoon dehydration. Research published in the European Journal of Nutrition found that adults over 60 who did not consume adequate fluids between noon and 4 in the afternoon were 62% more likely to report significant overnight dry mouth symptoms compared to those who maintained steady hydration throughout the day. 62%. After 60, your thirst mechanism becomes less reliable, your kidneys become less efficient at conserving water, and many older adults unconsciously reduce fluid intake in the afternoon to avoid nighttime bathroom trips. That combination creates a chronic, low-grade state of dehydration that peaks overnight, precisely when you have no opportunity to correct it. The fix is not to drink more before bed. The fix is to front-load your hydration earlier in the day. Aim for 6 to 8 ounces of water with every meal and with every snack. Keep a water bottle visible during the afternoon hours. And if you are concerned about nighttime urination, know that proper daytime hydration actually reduces nighttime trips for many people because the kidneys can concentrate urine more efficiently when the body is not in a chronic deficit. Pro tip: add a small pinch of sea salt and a squeeze of lemon to your afternoon water. This combination supports electrolyte balance, which helps your cells actually retain and use the fluids you consume instead of letting them pass through quickly. Now let's move to number 5, and this one surprised even me when I first encountered it in my patients. Number 5, vitamin deficiencies targeting your salivary glands. Your salivary glands are not just passive plumbing, they are metabolically active tissues that require specific nutrients to function properly. And 2 particular deficiencies destroy salivary gland function in adults over 60 faster than almost anything else. The first is vitamin A deficiency. Vitamin A is essential for the health and integrity of all mucous membranes in the body, including those lining your mouth, your throat, your nasal passages, and your digestive tract. When vitamin A levels drop, these membranes become thinner, drier, and less functional. A study published in the journal Nutrients found that adults over 60 with low vitamin A levels had a 41% reduction in resting saliva production compared to those with adequate levels. The second is B vitamin deficiency, specifically vitamin B3, also known as niacin, and vitamin B12. Niacin deficiency directly impairs the nervous system signals that trigger saliva production, while B12 deficiency causes a condition called glossitis, where the tongue becomes inflamed, smooth, and abnormally dry. Together, these deficiencies create a dry mouth that no amount of water can fully correct because the problem is not hydration, it's cellular function. After 60, your ability to absorb B12 from food drops significantly due to reduced stomach acid production. Research suggests that up to 30% of adults over 60 have inadequate B12 levels, and many have no idea. Foods rich in vitamin A include sweet potatoes, carrots, dark leafy greens, and eggs. For B12, look to lean meats, fish, dairy, and eggs. But for many adults over 60, supplementation is necessary because dietary intake alone may not compensate for reduced absorption. A good starting point is a B-complex supplement that includes at least 1,000 micrograms of B12 in methylcobalamin form, which is the most bioavailable version, along with a vitamin A supplement of no more than 5,000 international units daily. Always speak with your doctor before beginning any supplement regimen. Pro tip: vitamin A is fat-soluble, which means it is absorbed best when consumed with a small amount of healthy fat. Add a little olive oil or avocado to your meals containing vitamin A-rich foods, and you will dramatically improve absorption. This brings us to number 4, and this is where I need you to pay very close attention. Number 4, blood sugar imbalances overnight. If you wake up with a dry mouth and you also wake up to urinate more than once during the night, this combination is a warning flag I take extremely seriously in my practice, because together, these 2 symptoms are among the earliest signs of uncontrolled blood sugar, and in some cases, undiagnosed type 2 diabetes. Here is what happens. When blood sugar rises above a certain threshold, the kidneys go into overdrive trying to filter and excrete the excess glucose. To do that, they pull water from the body's tissues, which leads to increased urination. That fluid loss dehydrates the body from the inside, and one of the first places you feel it is in your mouth. A 2021 study published in the journal Diabetes Care found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and that many of them had experienced this symptom for over a year before receiving their diagnosis. Over a year, walking around with a blood sugar problem that was already speaking to them every single morning, and they had no idea. This is not a reason to panic. This is a reason to be informed. A simple fasting blood glucose test, which your doctor can order at any routine visit, can answer this question definitively. If your fasting glucose comes back above 100 milligrams per deciliter, your doctor will want to monitor it closely. above 125, and a diabetes diagnosis is on the table. I remember Margaret, a 71-year-old retired school teacher from Atlanta. She had been waking up with a dry, cotton-like feeling in her mouth for 2 years. She mentioned it to me almost as an aside during a visit for something else entirely. She assumed it was because her bedroom was dry. I asked her a few questions. Was she getting up to use the bathroom at night? Yes, usually twice. Was she feeling more fatigued than usual in the afternoons? Yes. Had she noticed her vision blurring slightly on occasion? Yes, she had, but she had attributed it to needing new glasses. I ordered a fasting blood glucose panel that same week. Her levels came back at 148 milligrams per deciliter. She had type 2 diabetes. She had been living with it unknowingly for what we estimated to be at least 18 months. She was devastated at first, but I told her what I want to tell you. Catching this early changes everything. With dietary modifications, a 30-minute daily walk, and targeted supplementation of berberine and magnesium glycinate, Margaret had normalized her fasting blood glucose within 4 months. 4 months. At her last checkup, she told me, "Doctor, I sleep through the night now. My mouth feels completely normal when I wake up. I feel like my body is finally cooperating with me again." That wasn't luck. That was information acting as medicine. Now, if you're finding this helpful, please hit like and subscribe so you won't miss the simple, practical health information we share every single week. And share this video. Think about someone in your life who wakes up with a dry mouth every morning. A simple click could start a conversation that changes their health. Number 3, autoimmune conditions affecting your glands. This is one that the medical community has known about for decades, and yet it remains profoundly underdiagnosed in adults over 60. The condition is called Sjogren's syndrome, and it is an autoimmune disorder in which the body's immune system mistakenly attacks its own moisture-producing glands, primarily the salivary glands and the tear glands. The result is severe dry mouth, chronic dry eyes, difficulty swallowing, and in many cases, systemic symptoms including joint pain, fatigue, and even kidney or lung involvement in more advanced cases. According to the Sjogren's Foundation, approximately 4 million Americans currently live with this condition, and women over 60 are disproportionately affected, representing nearly 90% of diagnosed cases. Yet research suggests that the average patient waits nearly 3 years from symptom onset to diagnosis. 3 years of unnecessary suffering. Why? Because dry mouth is easy to dismiss. Dry eyes are easy to attribute to screen time or allergies. Joint pain gets blamed on arthritis. Each symptom gets treated in isolation, while the underlying autoimmune process continues unchecked. The key diagnostic clue is this. If your dry mouth is accompanied by persistently dry, gritty, or burning eyes, and if you are a woman over 60, please ask your doctor specifically about Sjogren's syndrome. A blood test measuring specific antibodies, namely anti-SSA and anti-SSB, can identify the condition in most cases. There is no cure for Sjogren's, but there are effective treatments including prescription medications to stimulate saliva production, topical therapies, and in some cases, immune-modulating drugs that slow the progression significantly. Pro tip: for immediate symptom relief, sugar-free chewing gum containing xylitol is one of the most effective tools for stimulating saliva production available without a prescription. Studies show that xylitol-containing products also inhibit the bacteria that cause tooth decay, which is critical because dry mouth dramatically increases cavity risk. This brings us to the final 2 causes, and these are the ones that concern me most deeply because they involve body systems that go far beyond the mouth. Number 2, neurological changes and early cognitive decline. This is not something most people associate with a dry mouth, but the connection is both real and significant, and I believe every adult over 60 deserves to know about it. Your salivary glands do not work independently. They are controlled by the autonomic nervous system, specifically the parasympathetic branch, which governs rest, digestion, and recovery functions. When the parasympathetic nervous system becomes compromised, salivary gland activity drops. The mouth dries out. Now, here is what the research shows. Autonomic nervous system dysfunction is an early feature of several progressive neurological conditions, including Parkinson's disease and Lewy body dementia. And in a counterintuitive twist, while advanced Parkinson's is associated with excessive drooling due to swallowing difficulties, the early stages of autonomic decline in Parkinson's can actually produce dry mouth, particularly at night. A study published in the journal Movement Disorders found that autonomic symptoms, including altered salivary function, appeared in patients an average of 4 to 6 years before the classical motor symptoms of Parkinson's disease were diagnosed. I want to be clear, dry mouth alone does not mean neurological disease, not even close. But dry mouth combined with other subtle changes, including a reduced sense of smell, constipation that seems to have no dietary explanation, vivid or disturbing dreams, slight tremor in one hand, or a feeling of lightheadedness when you stand up quickly, that combination warrants a conversation with a neurologist. I think of James, a 78-year-old retired engineer from Philadelphia. He had been mentioning a dry mouth to me for about 2 years. We addressed the obvious causes, his medications, his hydration, his sleep position. Nothing fully resolved it. Then his wife mentioned in passing during a visit that James had stopped recognizing the smell of his coffee in the morning. He had noticed it too, but had not mentioned it because it seemed unrelated. I referred him to a neurologist. A dopamine transporter scan confirmed early Parkinson's disease. James was understandably shaken. But because we caught it early, he was able to begin neuroprotective therapies, make lifestyle modifications, and establish a care plan before significant motor symptoms developed. His quality of life today, 3 years later, remains high. He told me at his last visit, "I almost didn't mention the dry mouth because I thought it was trivial. I am grateful every day that I did. That is why I keep saying it. No symptom is trivial. Your body is always speaking. We just have to learn to listen." Before we get to number one, I want to hear from you. Have you been waking up with a dry mouth? Do any of the causes I've described so far sound familiar? Share your experience in the comments. I read everyone. And now, number one, the single most common and most dangerous cause of morning dry mouth in adults over 60. Number one, prescription medications. This is the cause I encounter most frequently in my practice, and it is the one that is most consistently overlooked, most underreported, and most poorly communicated to patients. Over 500 commonly prescribed medications list dry mouth as a side effect. Over 500. And for adults over 60, who take an average of 5 or more prescription medications daily, the cumulative effect on salivary function can be profound. The classes of medication most frequently responsible include antihistamines, including older over-the-counter allergy medicines like diphenhydramine, which is found in Benadryl and in most over-the-counter sleep aids. Antidepressants, particularly older tricyclics